Well, good afternoon, everyone. My name's Lisa Dishman. I'm the sponsorships and events coordinator with the Oviedo Winter Springs Regional Chamber of Commerce. Thank you so much for joining us, and we'll wait just a minute before we start. Bridget Lake, our chamber president, is on vacation, but you're in good hands with me today. And thank you for spending your lunch hour with us. We appreciate it very much. So we'll give it just a few more seconds, and then we will go ahead and begin. So I also wanted to let you know that the Oviedo Winter Springs Regional Chamber of Commerce is here as a platform for enhancing business and community interests in our region. And most importantly, we are a resource for your business, providing education, advocacy, and connections. So that for more to go on, we'll go on now. I'd like to officially welcome everyone to the Health Connections Zoom series presented by AdventHealth. This is our 5th of 6 Zoom series. So we have one more, and that should happen sometime in June. These series focus on the health and the well-being of our community by providing options to help reduce fears, manage stress, and provide tools and techniques to cope in this challenging time. Today's topic is Women's Health Wednesday. Yay! From handling the stresses of a pandemic to our daily to-do list, we as women often are so busy caring for others, that happens very often, that we forget to make our own health a priority. And I can definitely attest to that. Also, if you have questions, you're more than welcome to type them into the chat box, and our expert will answer those questions by the end of the program or throughout the program. So if you have a question that we're discussing about a subject right then and there, please go ahead and put that question in, and Doreen will definitely be able to answer that. And now let's give a huge thank you to our today's sponsor. It's AdventHealth. AdventHealth. A lot is overlooked this past year as we adjusted to life during the pandemic. We've adapted our work lives to longer, more complex schedules, or even adjusted to working from home. And in the midst of everything, many of us have even skipped important health screenings. I know I have. I'm definitely at fault for that. Since May is Women's Health Month, it's a great reminder to put your health back at the top of your to-do list. So definitely put you at the top of the list every single day. You can't care for loved ones if you aren't taking care of yourself. Just like on an airplane, when they tell you to apply your own oxygen mask before helping others, prioritize your own health and well-being, mind, body, and spirit. And AdventHealth for Women offers a great service to make it easier to find personalized care close to your home. Their complimentary women's health navigation team includes registered nurses who are here to partner with you throughout your entire healthcare journey, helping you find the incredible care you deserve. So write this down. So please visit womenareincredible.com to learn more. So that's awesome. And today's featured speaker is Doreen Forsythe. Doreen has a bachelor's in nursing and is a registered nurse and has been a valuable member of AdventHealth since 2001. She graduated from Villanova University in Pennsylvania and has over 20 years of experience in multiple nursing disciplines, including cardiology, neurology, surgery, and nursing education. Doreen is an experienced healthcare advocate and is committed to providing you and your family with the support you need throughout your healthcare experience. So thank you, Doreen, and welcome. We are happy for you to join us this afternoon.
Well, thank you. Thank you very much. And I have to say I was honored to be asked to do a presentation for Oviedo and Winter Springs. So when I moved down here now 20 years ago, I lived in Winter Springs. So it's just, I love the area. And so I'm really excited and to see the growth. I've been gone for about 10 years. I moved to the other side of town, but I just love when I go over there and see the growth, and very jealous that you have a Home Goods and it wasn't there when I was there. So what I wanted to do today was just to talk about getting us all back on track. And by no means am I saying that I am the poster child. I think I am in the same shoes as everybody else. I mean, 2020 kind of threw us for a big loop, and now we have a lot more things in place that we can slowly get back to our new normal, so to say. So just wanted to touch base. If we could go to the next slide. So real quick, just take a moment and think what fell off of your to-do list last year. You know, the pandemic stopped a lot and canceled a lot of fun activities, right? We tend to think that it canceled graduations, weddings that we maybe needed to postpone, family functions. But did it also cause you to neglect yourself and cancel doctor appointments or your routine health screenings? So as we said, we tend to make a to-do list, and women historically always tend to put yourself at the bottom of the list. So how do we work on and get steps in place to help bring us back up to the top of our list and start prioritizing ourselves while we are busy helping our family? So one thing with the doctor's visits, did we cancel or postpone our annual mammograms or our annual GYN appointments? So you're going to hear me talk a little bit about that. And we can rationalize that it all made sense because we did essentially hunker down last year. Everybody was just very fearful and didn't really know if it was safe to go outside. What safety precautions did some of these offices and hospital put in place? So we did have a lot of people that waited till last minute to seek help because of the fear, and then had more complex issues when they did present to the ER. So we really need to focus. So, but it is all okay. We can pick up and start anew. And we do have a great team. So Women's Health Navigation. So I'm not alone. I work with the team. And so we are there to help get you on track. So if you want to go to the next slide. Okay, so let's get back. So visiting your primary care and your GYN and other medical providers, if you have any specialists that you see, let's get some more appointments scheduled and a plan in place. So, you know, screenings that can help pick up those small yet significant changes that really, if you catch them early, you can make changes that can impact your future. So today we're going to touch base on women's health screenings, such as just your well woman exam, your annual mammogram, keeping track of your blood pressure, blood tests, which ones do we really need to know what our baseline is, so what there's changes, what we know, colonoscopy, also skin cancer, and then mental health. So we can go to the next one. So just talking about safety, I just wanted to touch base on this, that AdventHealth has many safety measures in place to keep us safe. So we are having so many more doctors offer virtual visits. So we have eCare, we have an app that you can download, we have our primary cares that are doing virtual visits, and even our specialists, which I think is just phenomenal. It makes it a lot easier, and I really think this could be the wave of the future. And we're going to have a lot more compliance because now you're taking away travel concerns for a lot of our older adults. So I think it's really great. But we're still doing temperature screenings at all of our entryways, okay? Social distancing. So you've heard a lot about limiting visitation, new waiting room policies and procedures. And doing that, we're able to have less people in our space and really comply with that social distancing. When you schedule, you might notice that you get a COVID questionnaire. So when they're doing that, they're really screening to see, have you been to, quote unquote, a hot spot? Do you have symptoms? do you have concerns that when you do come in, do we need to quarantine you away or isolate so that you don't expose anybody else, and so that we do have that safety comfort for our other patients and visitors. And then mask protocol. So I know you've probably heard a lot in the news lately that a lot of places are dropping their mask protocols, but AdventHealth, we're still keeping it in place. So we have that for all of our staff, our patients, and visitors. So we are pretty serious with that. So if you do come to any of our facilities, just be prepared to put your mask on. And then just thorough, frequent, ongoing sanitation. I mean, I've been in there myself, and they really have upped their game, and it makes me feel a lot more safe. So I'm sure that it will for you as well. And then next slide. Okay, so let's talk about, did we skip a slide? Oh, okay, maybe she deleted that one. Okay. So we have the Well Woman exam. Sorry about that. So Well Woman exam is performed by either your primary care or your OBGYN. So during this visit is when you're going to have your pap smear. So we recommend a pap smear every 3 to 5 years. Okay, so that is what we use to detect cervical cancer. Now, if you have a family history, when you go to the doctor, I encourage for you to share that history if you have any concerns, because that may change that general screening. So keep in mind that these general screenings are just a baseline. Everyone is so unique. So these are just the basic suggestions, but the doctor may put you on a different care plan. So keep that in place. And if you've had any abnormal pap smears, they're going to want to place you on maybe a more frequent monitoring. Okay. So just keep that in mind. And then, a pelvic exam. So pelvic exams are very important on an annual basis. If you've had a hysterectomy, a lot of women feel that they no longer need to see a GYN, or they no longer need to have a pelvic exam. And that is not the case. So we still need to have pelvic exams. That way, I mean, that is not, and just to get a little personal, it's not an area that we frequently can assess and look at unless you're getting the mirror out and seeing if there's any changes. You may feel changes, but there could be a visual change that could be indicative of something that needs further evaluation. So I always encourage, even if you have had a hysterectomy, just make sure that you are still having a vaginal exam. Does not need to be internal. It could just be looking at the exterior skin, but we just want to make sure that we are still doing that, or encouraging your family members to continue to ask for that when they're at the doctor. And then the big one is breast exams. So the doctor on your annual visit will assess your breast, and they'll see if there's any signs for concern, but also recommend for you to do your breast self-screenings, on a monthly basis. Get to know yourself so that when there are changes, you can detect them quicker. Okay. Any questions on this one?
Doreen, I do have a question on this one.
Mm-hmm.
Over the recent weeks, women have been coming forward experiencing irregularities in their menstrual cycle after receiving the COVID vaccine. Do you have any information about that?
I would have to refer that to an OBGYN. I have heard a little bit report out on that, but I do not have the research to really be able to give an appropriate answer or response. So I do know that I have spoken to a lot of women over the past year that have had changes in their menstrual cycle. And just speaking with some of the physicians, we really feel that it could be a stress level that is indicative for that change. But I have heard post the COVID vaccine that there has been change. So I would ask the provider, and just when we have more data, we can absolutely share that.
Great, thank you.
You're welcome. All right, you can go to the next slide. All right, mammograms, my most fun question. I feel like I've become the mammogram queen over the past few years. So it is so important. And I know that you hear it all the time that we need to do your mammograms. Everyone's asking, have you had your screening mammogram? And the reason why is it is so utterly important to keep up on that. Breast cancer is one of the highest diagnosed cancers. And we still have a lot of women that are dying from breast cancer because the lack of the early detection. So I hear stories daily of women that had the screening and they had no plans on it. And, the mammogram bus came and their friend brought them in and they went and had their screening. And sure enough, they were then on a journey to see if they had breast cancer. So it's really, really important. 1 in 8 women in the United States will develop breast cancer. So again, this is why we really think this is important. We do try to make it easy where we have, come the month of October, you see a lot of marketing information out there, $30 mammograms, 30-minute mammograms, just to encourage for us to get out there. But this is the main screening for breast cancer. So we recommend for it to be annually for women over 40. You may hear, and I put up here, that it could be 45. Insurances start at 40 that they will cover. So, but it's always back and forth. If you can start at 40, absolutely start at 40. Women that have a family history, or if there's a breast concern, speak to your doctor and they can order for you to have a diagnostic mammogram. So it's not a hard stop that you can't have screenings or a mammogram before 40. So keep that in mind. If you have concerns, always seek to a provider. But as soon as you have any concerns over your breast, if you noticing a dimpling, or you have a new lump or a secretion that is brand new for you, consult with your doctor and he will or she will order a diagnostic mammogram. So there are 2 main types of mammograms. So you have your screening mammogram, which is about a 15 to 20 minute procedure from start to finish. And they're doing just a basic overall view of your breast. With the diagnostic, this is a little bit longer. They take many more pictures. And if you had an area of concern on your screening mammogram, they are going to focus in on that area during your diagnostic. Okay, so a screening mammogram, you will usually have the test, go home, maybe get a letter to come back. With a diagnostic, and usually connected with a diagnostic mammogram is a breast ultrasound. They usually go hand in hand. So with that, typically after you leave, you know the results before further treatment. And we have breast cancer nurse navigators within our system that if you do detect concern or you need to have a biopsy, they are there to handhold you through the process. Another thing I like to mention is we do have a breast cancer fund that is for women that are uninsured and meet financial requirements. They do need to fill out an application, but that will cover you from diagnosis or from a screening to diagnosis. So that would cover for your screening, your diagnostic mammogram, your breast ultrasound, and a biopsy. And then from there, if they still need help, they can apply for other scholarships within the hospital. So, I mean, we do have that to offer, which is really great. And we do have a lot of women, especially this year, that have reached out for this, with women that have lost their jobs and lost their insurance. So just keep that in mind. Any questions on this? No? Because you can go to the next slide. All right, this is an oldie but goodie. So blood pressure screenings. So this is something that is so simple, but so important. So high blood pressure increases your risk for a lot. So for heart disease, heart attack, stroke, kidney disease, kidney failure, you really need to continuously monitor your blood pressure on an annual basis, starting at age 18. Now, if you have high blood pressure, if it's been diagnosed early, then you need to see a provider and get placed on a care plan for yourself for that. So you may have to start medication. So a normal blood pressure is 120/80. Some will say it's 120/60. So I've pulled different data. So it could be 120/80 is what a majority of it is still saying, all the research that I pulled. So elevated blood pressure is anything with your systolic that is over 120/80. Okay. Then there's different levels for hypertension. You have stage 1, that's when the doctor's going to tell you, okay, we need to make some modifications. Do you need to lose some weight? Do we need to change your salt intake? What can we do? They'll give you some time, but if it continues to stay elevated or if it does increase, then that's when they're going to start talking to you definitely about still changing your diet and exercising, but you may have to start an antihypertensive medication. So, and then just continue. We do call like a hypertensive crisis anything that is over 180/120. You have anything like that, that is a call 911 and get to the emergency room right away. So just really need to, I always throw this one in because it is so important on so many different levels. Okay, any questions on that one?
No, I think you're ready to go to the next screen.
So then blood tests. So this is simple, and this is why you need to get with your primary care to have annual visits, because if we know the baseline and you know your baseline, then we know when there's changes. So with blood tests, we can monitor heart disease. I list them all here: anemia, diabetes, thyroid disease. These can all be detected through blood work. And having that primary care to keep track of this is really, really valuable. So cholesterol, you want to know your numbers. You want to know your HDL, which is your good cholesterol, your LDL, which is the bad one. And if these are out of range, how can we improve it? A lot can be improved through diet. Unfortunately, with cholesterol and triglycerides, some are hereditary, that you do have in elevated levels, but a lot can be controlled through diet and exercise. So if we catch that early, what can we do? And then fasting blood sugar and a hemoglobin A1C. Those are an early detection for diabetes. I mean, if you have, type 1, that's insulin dependent, so you'll probably have been diagnosed before the age of 18. But for that type 2 diabetes, we do have a big increase in our population, and I think it has to do with fast food diets. So just keeping track of that is really important. And then your iron level, are you anemic? Your thyroid function panel. A lot of women, especially, and some men, will get thyroid disease. So they'll get hypothyroidism or hyper, and that can affect so many things. That can start giving you palpitations, fatigue, weight gain. Some have, if you go one way, you can have extreme energy and just restlessness and anxiety. If you swing the other way, that's when you're fatigued and you might see that weight gain. So knowing what your baseline is, then we can see, okay, well, look, your levels are now high or lower. Like now, maybe we need to start talking about thyroid supplement and treatment plans. So blood work, it's so easy, but we can take so much from it. Any questions?
Doreen, yes? For your iron level, is there something that you can, would a daily vitamin help with some of this, or is there some certain foods that you can help to increase your iron levels? Because the last time I gave blood, my iron level was fine. It was it was a little low, but it was still okay. So is there something that I can do in order for that to help the next time I give blood?
Yeah, absolutely. So you can take iron supplements. I would check with your doctor first. So iron can cause you to get constipated or have constipation. So just what is the appropriate dose for you? You may need to start at a lower dose and ease up to the appropriate dose. You can also have foods that are high in iron. I mean, that's spinach, like Popeye. That's red meat that can help you. So there are a lot that we can do for that, absolutely. And a daily multivitamin is really beneficial for your overall health. And now, right now, I know they're talking a lot with vitamin D and the importance of having vitamin D in your system. So that's a really good supplement to take as well.
All right, thank you.
You're welcome. All right, go to the next. All right, this is our most fun one, right? Is our colonoscopy. So this is our test that we have that screens for colon cancer. So we start screening at the age of 45. Now that might change depending on your history and your family history. If you have family history of colon cancer, absolutely get with your provider and he may or she may start screening earlier. If you have a personal history, if you've had a colonoscopy and they had to remove a polyp or they had to do extensive biopsies, they're probably going to want to screen you more frequently. A personal history of Crohn's or colitis, that's going to put you at a higher risk for colon cancer. So you do want to be screened more frequently. And these are all, at that point, you're going to be hopefully established with a GI specialist. And then they will put you on a care plan for you. And then, of course, anytime you have symptoms, if you have any blood in your stool, if you have extensive cramping, that is when you speak with your provider and get referred to a specialist. So a gastroenterologist, they can see you for a consult and then do your colonoscopy. Some will just get your prescription from your primary care and schedule you for a screening colonoscopy. And those are usually our low risk patients that will do that. But you can do that, and there's a lot of different options and facilities that are available that do offer screening colonoscopies. And a lot of insurances will give you, I don't want to say money back, but they will cover for the colonoscopy. So a lot of times if it's a screening, it's 100% covered, but I would check with your insurance for that. Another thing, if you ever had any radiation to your abdominal area, if you have history of cancer that you did need to have radiation, that is going to put you at a more frequent screening for colon cancer and colonoscopies. So, and I'll tell you now, the colonoscopy prep is a lot easier than it had been years before. And now the method of sedation that they are doing is a lot easier. You wake up and it wears off very quickly. So you still need to rest that day, but you are a lot more clear than previous years when we needed to kind of take off the whole day and rest. So any questions with this one? No? All right, well, next one. All right, so mental health awareness. Now, I just wanted to touch base on this. There are so many things that have happened over the past year. I mean, stress, anxiety, adjusting to a new work schedule, working from home. I mean, there's so much. If you had children, were they going virtual? Are they back in school? Just the stress of going to the store and is it safe? I mean, there was so much that of the unknown and just lacking with the interaction that we may have been used to. I mean, I'm fortunate I have a big family that lives here, so I never really had a lot of alone time. But for those individuals that lived by themselves, it really caused a huge change in their life. So just we're noticing now that there's a lot more need for just mental health treatment. So if there's anything that is going on, I'm absolutely here to help. But we want to talk about this to some ways to nurture. I think I have a different slide than what was here, but so just if some of us are feeling fatigued, and all of this can start impacting your physical health and your mental health. So if you're feeling any of those, I'm here to talk. I'm here to provide resources. So we do have a lot of mental health resources that are available on a virtual visits, which is really great because we used to have, a cluster of our mental health providers over here, but it was a big travel concern for a lot of our consumers. So with the virtual component, it's a lot easier. And also a lot of employers have increased their offerings in their employee assistance programs. So a lot of employers will offer, it used to be up to 5 sessions for mental health, and it's covered 100%. So if you do need to see a counselor, if there's someone for you to speak to, I would start with your employer and see what they offer because that's the best financial option. But there are also a lot of support groups that are offered virtual. So I deal a lot with women that are experiencing postpartum depression And that is also on the rise, just with the lack of support for women when they bring their new baby home. So maybe the mom or the dad that used to come and visit, or the grandparents, they're not there, or they're not comfortable with traveling or so forth. Or I think it's gotten better, but the meal drop-offs that women, when you had a new baby, your friends from your church maybe have dropped off and put you on a meal train. That is coming back. But for those years of COVID and when everybody was on lockdown, it was really, really hard for those women. So I really want to say I was very impressed with just our mental health professionals and how they got creative to help offer. So much. So any questions on this one?
I don't think we have questions. Don't forget, if you have questions, go ahead and just chat them in the chat box, please. All right.
Yep, we can go to the next slide.
Okay.
All right, and then discussions with your medical provider. So I put this on here just so that I didn't forget. When we do go to a doctor, I always encourage for you to be as prepared as you can. So women, we're great at making lists, right? So make our list for when we go. Let's write down all of the questions that we have. If we have any family history, maybe call that family member and ask them what it is that they had, or get a better story. So when you're in front of the doctor, you're able to have everything right at your fingertips. And so you don't need to reschedule or send a message in. And then what are your health goals? What is your mental health status? There's a lot of interventions for mental health that we can do. There's a lot of medications, but there's also a lot of coping mechanisms that can be added. If you're family planning, start talking about that. But then any problems or changes since your last visit, keep track. I know a lot of times, even when I'll go into the doctor's office, I know I want to talk about one thing, and we get so derailed in conversation, I leave and I say, oh, I never asked that one question. So, and when choosing your medical provider, it's really important to choose somebody that you feel comfortable with, that you feel will listen to you, and that you feel heard. It is so important, especially with women health issues. So many women do not want to talk about some of the sensitive topics, and there is a lot of help once you relay that information. So we deal with women that have urinary incontinence, but they're so embarrassed to talk about it, or they may have pain with intercourse. That's not normal. And we can get you set up with the right type of provider. There is pelvic floor rehab. These are physical therapists that are trained on just your vaginal health, and they can help strengthen your vaginal wall muscles, or sometimes women need to do treatment that will loosen an area because you may have just a muscle that is so tight. So there's a lot, and when you have that comfort level with that provider, you can gain so much more. Now, I love that my team, when you do call in, we listen. I mean, my thing is I want to get a relationship with the women that I speak with and get that comfort level. And then I try the best to match you with somebody that's going to be appropriate for you and that to set you up for success. So we get to know a lot of the doctors, and we know who is at the top of their skill set, who has the best bedside manner. I mean, we keep track of all of that. And so when I get to know you, I try to match you the best. So we can go to the next slide. All right, so kind of touch base on our women's health screenings. Now, there are many more. Like in the first slide, we did talk about, skin screenings and skin cancer. So just always, that is something we should do annually, especially in the state of Florida when we do spend so much time in the sun. And if you have a medical history that has a need for you to have additional screenings, that is something that we can talk offline. But these are just the general. There is a lot more. And like I said, these are just the general and just the general guidelines. But wanted to to get it to be top of mind. So then I just wanted to take a few moments and just tell you about health navigation. And if you want to go to the next slide. All right, so this is us. There is myself and Janelle Grawl. So we are both registered nurses. We cross-train to do both women and children's. So if you call and you reach either of us, we're going to be able to help you. So originally it started with just a women's health navigation, and then realized we're speaking to so many women that were mothers, and we want to be able to help everything that's on that woman's shoulders. So if it's helping take care of her children, let's bring in a pediatric nurse and let's make some relationships with our extensive pediatric specialists, and that will have more at our fingertips to really help it and be beneficial. And then you can go to the next slide. So what do we do? So this program really was created for women in our community. It's completely free. We are here to help answer your healthcare questions. Like I said before, help find the provider that's right for you. Assist with your annual screenings, kind of touch base. I still offer, one-on-one conversations. If you want to schedule a time, we can kind of just take where you are with your health right now and where you want to be and kind of work towards that. And then we just act as a resource and coordinate care among a lot of our other providers and facilities that we have in our market.
So Doreen, you're really making it easy for everybody to get everything done. You're kind of like the one-stop shop.
Yes.
I mean, I don't want to put, you know what I mean, put in it that way.
Yeah, I mean, we really, when we developed this program, they wanted, it's called women's health. Now, women's health, yes, is OB, is GYN, is breast health, but women are so much more, so with the experience that I have within all of the other disciplines of health, we thought that it made sense. We're going to need primary cares. We're going to need a cardiologist. And if one nurse can talk with you and talk you through all of your needs, that's going to be so much more helpful than just speaking to one nurse for OB, one nurse for GYN, and then have to patch you. So we just wanted to make a relationship with women in the community so that you feel heard and we can help you. So yeah, you can go to the next.
Okay.
So, I said here, just an example, what does it mean that we do? And it's just limitless. I always joke, if people really knew how we can help, we would need about 50 of us. So, I mean, our numbers have increased, but really the amount that the team does is significant. So we can help with insurance changes. So if you have a new insurance and all the providers you've seen for years no longer on your plan, where do you start? So yes, you can get a list from your insurance company, but what does that mean? Who's the specialist for this? They might be very unfamiliar to you. And then another one, that you're having pain, and where do you start? Some women will get a new diagnosis and they don't even know what the diagnosis is, and they've been told they need to see a urogyn, and women are like, well, what is that, and where do I start? So that's where we can help. We also help with pediatrician, finding the right one. Again, sometimes I feel like a matchmaker because we really try to get what's right for you and your family. I will provide some resources and talk through some options so that you as the consumer are really making that final decision. I'm just helping guide you there. And then any breast concerns, we can help get you scheduled. We can also help connect you with one of our other nurse navigators. That women's and children's navigation is more broad, where we do have disease-specific nurse navigators within our system that you might be better or more beneficial for us to connect them straight to you. They talk about it every day. We have the connections with those providers. So, but we can absolutely connect you to that. And then the next slide. So this is one of my favorites. So a friend of mine sent this to me. She's like, this is kind of like what you do. So people come to us and they're in a state of confusion. They're stressed with a new diagnosis. They just moved to town. they saw multiple specialists, say in Michigan, and now they're in Orlando, and they don't really know where to start. So we're able to put them on the right track. So we take the time. Sometimes it goes back and forth. I mean, sometimes our communication isn't just one phone call. Sometimes it's, let me do some research and get back with you to see who's the best one. And we're, behind the scenes sending notes to the doctors and saying, is this a patient that you would be able to see, especially women that have had complex surgeries in the past, or say multiple surgeries for endometriosis, and what's the right direction to put them in. So I feel like this is my daily. And the next slide. So this is when we were developing the program and really just seeing the need. We pulled some research, and it showed that the average patient could see 7 doctors during a care process, just even for one diagnosis, because they may start with the wrong doctor. They may see, for example, if you need to see an interventional cardiologist and you start with a general cardiologist, you may have that appointment and then realize that that's not the right doctor for you. So then you need to find the specialist that is for your specific need. So having nurses that understand the system, understand the diagnoses, the care plan, the processes, really limits and makes it easier for the patient and families that we do get to connect with. So yes, we try to keep it easy and help from our patients from falling between the cracks that sometimes can happen. So, and then one more. I saw this one and I loved it. So I don't know if you've seen this animation before, but this is just like the average trip to Target, right? So a man will have a very direct direction or plan, and he'll go in, and then women, we're all over the place because we are managing everything. We're managing, most women, our household, our children, our husbands, maybe our parents, our in-laws, the friend at church, or our neighbor. There's so much that's going on in our brains at one time. So that's where we're here to help you, to be that helping hand, to get you on track. And we can help when you call us with your neighbor and we can talk to your neighbor. So just wanted to introduce the program and that we are here at any time. And then if you go to the very last slide, so this is all of us. So now the one in the middle, her name is Lindsay, and she is a key part of our team. So you have myself and then Janelle, who are our nurses, and Lindsay works, she's our behind the scenes superstar. So she answers a lot of our phone calls and she helps triage it to one of the nurses, and we have made care plans so she can help with a lot of time. She's been with us for 2 years and just learned very quickly. So if you do call in and you get Lindsay, if she cannot help you, she will absolutely connect you to one of the nurses. So we also have a Spanish speaking nurse that has joined our team. She's part-time, and we are in the process of bringing her in full-time. So then we'll be able to offer all of our Spanish speaking women in the community. So, but do you have any questions for me?
Well, I don't know. Anyone, if you have questions, go ahead and just type it in the chat box, and we'll just wait here just a second. I had a question from somebody. When should women get their first gynecological exam? What age?
So typically they say the age of 21, or if you become sexually active.
Okay. All right. Any other questions for anybody? I don't think we have any.
Now,
wait a minute, we have a question. Oh, thank you. It was just great information from one of our participants. Thanks, Vicki. Appreciate that.
Now, if you ever need anything, or if you do think of something later, or if it's more personal that you don't want to ask in a live chat, please, you can fill out a form on herhealthnavigator.com, and that comes directly to my team, and then I can reach back out to you. And you can always give us a call directly We have a direct line number, but I think her Health Navigator will provide the phone number that brings you to our website. So.
All right. Well, Doreen, thank you so much. And don't forget, everyone, that May is Women's Health Month. And May is a great reminder to put your health back at the top of the to-do list. So I think we all need to make sure every day we put ourselves first, at least for something. I also want to thank everyone for joining us this afternoon and spending your lunch hour with us. And thank you to AdventHealth for another great educational and timely health connection Zoom series segment. The next one will be in June. Don't know the subject yet, but we will see you guys in June. And thank you, everyone, and have a wonderful afternoon. And thank you, Doreen, again. Appreciate it very much, you spending your lunch hour with us as well. Thank you.